My name is Dr. Bill Keck. I'm chair of the Academic Health Department Learning Community and the Council on Linkages between Academia and Public Health Practice. It's my pleasure to welcome you all to today's Academic Health Department Learning Community webinar entitled Partners for Public Health, Pima County Health Department and the University of Arizona. Before we begin, however, I'd like to ask Kathleen Amos over some of the housekeeping items associated with the Zoom software we're using today and offer my thanks to Abdullah Tawkir, who is assisting us with technical issues. Kathleen, what?
Yes, thank you, Bill. And thank you everyone for joining us today. We're really excited for this webinar. I'm pleased to see so many people here. So we wanted to just go over a few housekeeping items as we get started. Number one, we wanted to let you know that all attendees are muted. You do have a couple of options for audio for the webinar, so you can either listen through your computer or call in over the phone. And if you need to change that for any reason, there's a little carrot or little kind of triangle thing next to the microphone icon that you can use to switch your audio. Please feel free throughout the webinar, throughout the presentation today, to share your comments or your questions for our presenters through the chat box. We will have time for Q&A at the end, so we will address as many as possible then. Please also, if you have any trouble with the technology, if you need any help, feel free to shoot us a message in the chat box and we will help troubleshoot. And finally, we wanted to let you know that the webinar is being recorded today. We will share the archive with all of you and with others who are not able to be here today after the live event. And we have posted the slides for the webinar online as well, and we will Abdullah actually just put that link in the chat box. So if you want a copy of the slides, feel free to grab them from there. And any of the links that are included in the slides are live in that handout. Thank you.
Thank you, Kathleen. Well, some of you on the call are new to us, so I want to take just a few minutes to fill you in a bit about our learning community background. We are a product of the Council on Linkages between academia and public health practice, and we're staffed by folks from the Public Health Foundation. The Council, as you can see, is made up of 22 national public health organizations, including the Centers for Disease Control and Prevention and HRSA. And our funding, for which we're very thankful, obviously, comes principally from the CDC. We have three major goals that are listed on the slide for you on the left side. Now, all of them are related to linking academia and practice. The next slide. We're often asked just what an academic health department actually is. A wide range of agencies, institutions, and arrangements are involved in these partnerships, making a tight definition difficult and perhaps actually unnecessary. This slide contains some of the phrases we use to describe these arrangements, and we present them here in hopes they might be helpful to understanding and useful to you. I won't go through each of them, but encourage you to download the slides if you want to have more time with them. And the next slide, Kathleen. The learning community has grown to about 1,200 individuals now since we began in early 2011, and over 60 academic health department partnerships have connected with us. Now, the Council on Linkages is perhaps best known for its work to develop core competencies for public health workers. But the learning community is also an important program for us. The learning community is now completing its 10th year, and our activities are noted in the bullet points on the slide. If you're not a member and wish to join us, just drop an email to Kathleen Amos. She has a simple email address. It's her first initial and last name, kamos, at phf.org, at thepublichealthfoundation.org. And the next slide, please. This slide shows you the distribution of our learning community members across the US. There are the yellow dots, as well as the location of the academic health department partnerships we're aware of. There are obviously many more than shown, but these indicate those agencies that have been active with us. And now slide 7, please. I want to briefly introduce you to today's presenters. We have presenting today Julia Flannery, who's the Organizational Development Program Manager for the Pima County Health Department, and Emily Waldron, who's Community Engagement and Outreach Coordinator for the University of Arizona Zuckerman College of Public Health. So Julia and Emily, take it off.
Good morning. I'm Julia Flannery, and it is a pleasure to be here, and we want to thank the Public Health Foundation for this opportunity to share our story and the journey of this relationship. Emily?
Yes, I'm Emily Waldron, and I also want to echo the thanks from Julia, and we're very excited to tell you our story and where we are today.
We'll begin with the Pima County Health Department. I'll give you just a few general facts about where we're at. The Pima County Health Department is in the southern area of Arizona. We are within the Sonoran Desert, and we encompass approximately 9,000 square miles. And it is home to 3 Native American reservations and the second largest city in Arizona. Our population is roughly 1 million, with about a third of the population living outside of any incorporated cities or towns. We have Pima County also has a 123-mile international border with Mexico. And the health department supporting this environment and these people is approximately 300 employees. And we are a nationally accredited public health department and are currently seeking our reaccreditation for this coming year. Emily?
Thank you. So the University of Arizona Milton Eden Zuckerman College of Public Health, which we call MESCOF around here for short, we are located, we have 2 locations, but I'm located, our main campus is in Pima County, which is where the health department is. And then we also have a campus in Phoenix. MESCOF was founded in 2000. And we actually just went through our reaccreditation process, and we were reaccredited again this year, and we're the only accredited public health college in Arizona. We have a campus in Phoenix, and we offer degrees, bachelor's degrees, MPHs, master's degrees, DRPH, PhDs. And we serve our faculty and our staff, we serve the state of Arizona. So even though we are we're located in Tucson and in Phoenix, we do serve the whole entire state. We have 3 academic departments at our campus in Tucson, and we have 1 academic department at our campus in Phoenix.
So early efforts in building a relationship. The health department, oh, sorry, Emily, I missed you.
Can we go back to the last slide,
Yes,
Kathleen?
Kathleen?
Yeah. So we're going to talk a little bit about our journey, about how we became an academic health department. So we're going to start in 2017, but Julia is going to share a little bit, but our relationship has been a long time before 2017. 2017 is when we started the process of formalizing the academic health department. So Julia, take it away.
Thank you, Emily. And again, my apologies. So as Emily mentioned, we have over time wanted to explore how do we start to build a better and stronger relationship with our academic partners at the University of Arizona and the College of Public Health. And these efforts would often be centered around maybe a shared interest or a specific individual or maybe one program, and it was like a one-off opportunity. When there was a change in that relationship, maybe a staff person left or the funding went away, there wasn't anything in place to sustain that relationship and that continued movement forward. We also found that the differences between each of our organizations created a little bit of what felt like a separate or a distant, too much of a distance to cross over to each other. So we allowed that distance to kind of be a little bit of that indivisible barrier. Some of the other things that we did as a department early on is we would reach out to the Western Regional Public Health Training Center. They would help us with different projects for our staff, or maybe in developing trainings that we needed that promoted some of the public health things that we were training in-house. Maybe we would reach out for grant funding opportunities. There would be something that we were seeking grant funds, and we would bring in our academic partners to work with us on that. And then we had staff that would occasionally keep those relationships that were alumni and recent from the college, and they would continue to work with them on those opportunities that were kind of in place maybe while they were a student, and they just kept working with them. Changes and request in the evolution of what we were doing is, as a department, we stopped and we started to look at formalizing some things, such as seeking public health accreditation. When that was launched as a department, we decided to embrace that endeavor, and we sought to become accredited. We worked together to create public health internships. So the University of Arizona, needing internships for their student, would reach out to us. We hadn't yet really formalized what that was. Again, it would be these unique opportunities to meet an individual need and not necessarily setting up that bigger process. Our leadership throughout time have been very supportive and interested in building this relationship. And in that, by doing so, we hope to become that educational and that teaching hospital kind of environment as a public health department. But not all the pieces were in place, and we still needed a few more things in order to move forward. Next slide.
Yeah, so from our perspective, Julia kind of talked about what was happening with Pima County Health Department. And from the College of Public Health side, we had, again, there's those one-off relationships with the health department. There was 1 or 2, 3, 4 faculty members who worked with the health department. But again, when that faculty member left, or that student who maybe worked with the health department left, the project ended, and the relationship didn't continue. And there was really that lack of clear and consistent contact with staff at the health department. You know, I think that first slide of the 2 picture of our 2 institutions gives a really good visual, and it shows that we are these large, imposing institutions. And I think for Julia and I heard from both at the College of Public Health and at Pima County, where do we even begin? And we saw people who maybe had those one-off relationships, but we didn't really know how to get into those institutions. So around the College of Public Health, we started to talk about, okay, how can we really foster this relationship so it moves beyond that one-off relationship? So that's when I'm going to bring in a little bit about a personal story, my background. So I was very lucky because I worked for the American Lung Association for 2 years before after getting my MPH from the College of Public Health at the University of Arizona. And I actually had a position. My position was actually based in Pima County Health Department, which was great. So I had such an advantage because I knew everyone. I was out of tobacco and chronic disease. Then when I switched over to going back to University of Arizona, I worked for a little bit as the online MPH program advisor. And in that role, I saw there was a lot of opportunities for students that we really at the college weren't leveraging with the health department. And again, I started to work a little bit more with the health department. I knew people, but again, there was that same situation where I was bringing on those one-off relationships, and we really needed something bigger. So during this time, I started participating in these planning meetings and discussions with our health department partners, talking about not only what we needed from the College of Public Health, but also what they needed. So how can we make this a win-win situation? Mm-hmm. Next slide.
So in these conversations between Emily and our staff with other faculty and department chairs, we recognized that some of our attempts had been this pattern of stumbling and starts and restarts. And we were interested in something that was more of a long-term relationship. And so we started with what we knew was a mutual focus and desire to have a stronger and more robust internship program because it supported both health department activities and it supported the students' learning objectives within the academic institutions. And by working together and looking at this, we felt like that was a great place to start building this relationship into something that was a little more formalized and structured. But we knew we had to get to work. We didn't have anything formal in place, and we had to look at what do we need. And we spent some time putting that together and trying to identify what those protocols and processes were. But ultimately, we had leadership support in using this as our first step in that process of building the relationship. Next slide. So this brings us to this kind of pivotal moment. We realized we had a common denominator. We had interest from the University of Arizona. Both organizations were starting to engage in this active listening and dynamic opportunities to look for each other and work on programs and projects together. And with this energy, we stopped and said, wait, I think we're in a good place. Some pieces are starting to fall into place. Next slide.
Yes, and as Julia said, really this is about, we're trying to give you guys some dates so you can tell how this process unfolded. So in June 2019 is really where that mutual buy-in, which Julia was talking about, came into play. We saw, so U of A at Kickoff, we saw the health department leadership. They were ready. They wanted to work with us. From our end at the University of Arizona College of Public Health, our dean saw it too. And then we also had a new, there was a transition period going on, and we had a position that had been empty filled with the new Associate Dean of Community Engagement and Outreach, Dr. Cecilia Rosales. And she decided that she wanted to also support this initiative. So having the leadership from both the health department and the College of Public Health was so important to have that mutual buy-in. And then we started talking about how can we get people talking. So we had a planning meeting, and it was a great opportunity where we invited, I think we had like, I don't know, 80 people there from both of our organizations coming and talking about how can we get together and work on these, first of all, what are their priorities and how can we work together? We had dedicated resources. So both Julia and I being able to devote time to coordinating the academic health department, getting people together, making those connections of people who have a lot in common, but maybe their paths have never crossed. It was this amazing synergistic dialogue and how we could work together to accomplish more. So we came up with visions and activities and developing something that was mutually beneficial. We wanted to make sure that both the health department and the College of Public Health felt that their needs were being met and felt like it was a worthwhile activity for our faculty, staff to get involved with. And this really breathed, again, some fresh air into the relationship. I mean, there has been so much that's been accomplished before Julie and I started this journey together. But I think this was a great time to reinvigorate the relationship, and this pivotal moment sure helped us do that. Next slide. Cool. I think you're muted, Julia.
I am. We referenced the fact that we have this leadership support, and within the department, that leadership support translated to a commitment to building the relationship, a commitment of staff and resources to help foster and care for this relationship. By becoming accredited, we found in that we wanted more with our partners at the the College of Public Health. And these things started taking place where we looked at our department and we were getting excited about what we were achieving and how we were structuring and becoming more rigorous and more quality focused. We looked for those opportunities I mentioned with the Western Regional Public Health Training Center and the dedication of resources to support all steps within this. By having the responsibilities within my area of academic health department, we were able to be a point of contact. And so the department could call and say, I need X, Y, and Z. And I could pick up the phone and say, Emily, we're looking for X, Y, and Z. Emily would be able to help us make that connection. And then off they would go. We would help them introduce each other. And then that relationship and those needs and the ideas and the exchange of conversation and opportunities took off all on its own without having to necessarily come back through the point of contact, but the point of contact helped that grow. And as you can imagine, that became a more energetic commitment. Individuals were taking ownership of the relationship and responsibility and looking for how to make that a stronger and longer lasting relationship. Emily?
And I have to echo what Julia said. So you can tell the slides here on both sides are very similar. So we were also seeking academic reaccreditation, as I mentioned in the intro when I talked about our reaccreditation. And part of that, it's so important to look at where our alumni are working. So all of a sudden we realized, oh my gosh, we have so many alumni working in health departments, Pima County Health Department taking a ton of our alumni. And we also wanted to reach out to them because as part of our reaccreditation, we have to look at what we're doing in the community. So it made us, it forced us, and we wanted to, but look at, okay, where are we in our relationship with Pima County Health Department, and what can we do to build onto that? I already talked a little bit about the buy-in from Mezcoff leadership and the new interim. She's now no longer interim. She's now our associate dean. She came in and then my position was created. And I think that was really nice. I think from our perspective, just having somebody who could kind of help be there for the health department, be able to answer those questions, and then vice versa. But as Julia said, having a point person, somebody to know you can go to, again, breaking down those huge institutions, which we saw on the first slide. And again, I want to echo the energetically committed. We saw just the faculty and staff at Mezcoff be really excited about this relationship. Next slide. So as Julia mentioned, we needed some early wins, and a big one was the internship program. This was a very large win, and so we started working on this. And Julia is going to give more background out about it, but we're still very active with our internship program. If we can go to the next slide.
So as Emily mentioned, and as I had mentioned, the internship program became such a focal point for what we can do because it was an avenue and an opportunity to be able to interact more so with department chairs and faculty and the college itself and bring them into the work that we were doing. So back in 2016, we had 6 interns and we started putting that program into place using those internships and the interns' feedback to help us think about what we needed to put into process piece to make that more sustainable. So we launched in the fall of 2017, and we felt we had some good things in place. We had electronic applications, we had process pieces, we had thought about, who in the department would be able to help foster and support the internships. But it was within just a few short weeks, oh my gosh, it was like drinking from a fire hose. We were overwhelmed. The students were so excited that they just flooded our website and looking for those internship opportunities. So we had to recognize, okay, wait a minute, we're missing pieces. There's gaps in this process that are really important to sustaining a strong internship program. So we paused. We said, all right, this is good. We've got a good start. There were some significant gaps that we really needed to address and look at. And so we didn't do that alone. When we took that pause, we retooled and reinforced, and we worked with our partners at the College of Public Health, and we examined those areas and we reinforced them based on their feedback and things that were happening here in the department, where we relaunched again, as you can see, in 2018 and accepted 23 students that fall semester, which was remarkable. We were excited and we were kind of holding our breath. Is this going to work? And sure enough, we were able to say that for 2018, we had 39 interns. 2019, we went to the 55 interns, and we were poised to go even bigger and broader when, when we had 2020 and COVID kind of derailed a little bit of what we're doing because we needed to focus on the community response and whatnot. So some of these things, such as the internship program, had to be put on hold while we worked on the safety and whatnot with the community. 2021, so not losing that energy, not losing that relationship. We have been we have been talking with the College of Public Health throughout about what are those opportunities for virtual internships? What are those opportunities within the response that students could potentially engage in? And we're currently in the middle of some discussion about how do we bring the students from the College of Public Health, College of Nursing, the College of Pharmacy, and the medical school into a student internship and or rotation to help us with the vaccine distribution that's coming up in the next few months. And we're very excited about that because this gives an opportunity that is unique to these students who have already dealt with a unique environment to be able to be a part of this response and help us get the vaccine into the community. Emily?
Great. So I want to echo the internship program from our perspective, kind of what we saw. So one of the things that happened as the Pima County Health Department put all of this work and time and energy into retooling their internships, we became more aware of just how, what a great opportunity this is for our students. And one of the things we realized as our relationship grew is we want to make sure that we're sending them students that are our best, that are good representations of our college and that will serve the needs of Pima County Health Department as they work with our faculty and the community. So we started to communicate differently with our Office of Student Services here at NESCOF. We started to talk more about how it's a competitive selection process. There's an interview. You need to be able to make sure you're ready to communicate how you can support the health department. Make sure you dress professionally for your interview. And that really helped us in terms of, I think, our students, in terms of preparing them for the real world and when they actually seek jobs after they graduate. And then additionally, looking at what Pima County did, inspired me, honestly, with the academic health department here at NESCOF to create our own internal internship program. So by looking at, as we've expanded, and I'll talk about this in a few slides later, but as we've taken this model that we're doing with Pima County Health Department, we've realized we need more students to help us. And what's great is if we can get students who, number one, are from the community where we have where we're working with the health department. So in Pima County, getting students who are from Pima County, who are familiar with the needs of the Tucson, Pima County community. But then also, we started to look at students with a graphic design background, and we'll talk a little bit more about that. But seeing what Pima County was doing, how they were bringing in students, not just public health students, they were bringing in students with different backgrounds. And seeing that actually, like I said, inspired us to create this internship program. And so every year I have, or every semester, I have quite a few interns on our website. We'll give you the website in a few moments. And that has really enabled us to get a lot more work done because we have those extra talented students. Oh, are the students all MPH students from NESCOF? I'm just going to answer that. No, they're not actually. So I have a lot of I have some MPH students from NESCOF, but then I also have a lot of students from other colleges. So I have the studio art. I have communication. So really, I have a ton of. We advertise actually on Handshake, which is one of our internal postings, which goes out to all the students in any college. So thank you for that question. Next slide.
So as Emily was talking about, we started looking for these opportunities to bring the students in, to building the internship program. We also talked about what if we brought the students in to participate in our new employee orientation. In this, it was introducing conceptually what the health department's focus and purpose is in the community, what our programs look like, what we're doing, why we're here. And they were able to participate in this experience with other new employees and hear the typical questions and participate in the discussion. We offered it quarterly, and the orientation lasts for 4 hours. And these students usually got to interact with anywhere from 15 to 25 employees. And it was done in partnership with the College of Public Health, and they were very instrumental in helping us to identify those students. Emily?
As Julia said, yeah, so we advertised the opportunities to students. It usually went out in an email, and there was an application criteria. So they had to send in their resume, really be able to express why they wanted to be part of this opportunity. Again, I think that shows the commitment. We wanted to make sure we were sending Pima County Health Department star students who truly might even be interested in working at the Pima County Health Department one day. So we usually would select 5 students. And, you know, I was just thinking about this, that we've actually had quite a few students who have attended who now work at Pima County Health Department. Yes. So yeah, so that's kind of been neat to kind of see now, looking back over the past couple of years and see that these students, they went to the orientation and now they're working at the health department. Next slide.
So at this point, what we would like to do is talk a little bit about some of those elements and the nuts and bolts of how the growing partnership started to become structured and formalized in a way that we feel has greater sustainability. Next slide.
Yeah, so formalizing the partnership. So we actually signed a memorandum of understanding, and that was really good because we have this, and we actually got it. I have to put a plug out for the Public Health Foundation. They have great examples. So we were able to use that and kind of tailor it to the needs of our partnership. And then we also had planning meetings. We had a lot of planning meetings before we finalized our MOU. And in those planning meetings, we actually came out with the action plan and for the first year. And that plan, again, a lot of that was focused on networking, meeting people, breaking down those barriers. That really was our deliverable. It was getting people to know each other, so there's not that fear of almost intimidation. I think there was that of how do I work with such a big institution. So in August 2019, we had a kickoff event at Pima County Health Department, and you can see right there, there's our Dean of the College of Public Health speaking, Dean Aman Hakim, and we had a really great turnout. And again, that just goes back to show the energy. There was so much energy about this relationship. Next slide. So here's a little bit on our website, and like I said, I'll put it in the chat here, but our website provides a little bit more of a background on what we did with Pima County Health Department. And then there's also some other tools that I'll mention as we continue on the presentation. So as you're probably gauging along the way here, relationships are so key. Having an academic health department in practice really requires having those established relationships and bringing in the conversations and building on the opportunities for faculty and staff to get to know each other and be in the same place. So creating that space, whether it's at the health department or at the College of Public Health, looking for where we can collaborate and start to have those conversations and get to know each other was critical to a lot of what we were doing to build this academic health department. Next slide. And to talk about that, so we were looking at creating that space, and examples of that were, we created a mini public health school. This was an amazing opportunity where faculty or department chairs and health department staff who are working on similar topics and areas of interest would collaborate and provide a presentation for both agencies or organizations and the staff to attend and hear what that work looks like, whether it was research, a project, an opportunity to explore and do assessments and find out what's happening in certain areas of need. These happened monthly. We would have anywhere from 35 to 100 people show up, and it was very exciting. Every month we had it, staff were looking forward to it. When we had to put it on hold, the groans could be heard for miles from here. People were wondering where did they go, but we will resume those. The other thing that was very exciting about this is that the college made available to us an opportunity and an invitation to come to campus and participate in their campus-wide seminars, which were also monthly
topics of public health interest that they would bring in guest speakers or faculty within their the college would present. And our staff were able to go and sit with students and hear what was being presented on a monthly basis at the College of Public Health. And it was one of those, again, breaking down the barrier and creating space for the collaboration. The other exciting thing is that the College of Public Health is sponsoring designated campus colleagues. And this is a status that's formalized affiliation designation for health department staff to have access to the College of Public Health and to the College of Public Health Library, which was such a big need in the department. Not having that access as freely as we had when we were students made it very difficult for staff to sometimes find out what were current and things going on in the world in the field of public health. It was an avenue to also work with and connect with department chairs. You went on campus, you could find their office, sit down and talk about things. So this was something that we did, and the department heads and chairs would work with groups with some of the staff to help us identify projects that the department chair was aware of, and then we would try to collaborate and find how can we take that a little bit further, look for some funding and some shared opportunities for maybe grants and research projects that we could work on together and publish. It's okay, Kathleen, we're ready. Emily?
And then as you know, the DCC status continued, we started to get faculty who would bring in their students as well. And so they would be working, the faculty and the student would work with Pima County Health Department. Another great collaboration. The internship program just continued to grow with both Pima County Health Department and with the academic health department with MESCOF. And we actually created this, the website, the academic health department website. And that's just been great. Again, that's been a really great resource just for people to know what's going on. Like Julia mentioned with the DCCs, we have all of the DCC information there on the website. So for our perspective, as with faculty and staff, usually you can find our contact information on our website and how to reach us. But at Pima County Health Department, being a health department, it's not as available. So it's great having that information on our website. So faculty and staff can just look up people on there, see what area the staff is working in, and then contact them that way. Another example is we started the Smoke-Free Wildcats Club. This was actually a collaboration with a faculty member, Mark Martz, and students as well as health department staff from Pima County. And it really was Pima County Health Department really drove this. But they created a group of faculty and to advise the student club to help them with grant deliverable, for the REACH grant. And it was a great way. They were going out before the pandemic. The students were actually going out to apartment communities to help the health department with the work on smoke-free housing. And like I said, we had faculty also involved with that work too. So that was a really, really cool collaboration. Finally, we also, we had the annual Academic Health Department Western Regional Public Health Summit. It was launched in 2019 in Vegas. It was really fun. So Julia and I were on the planning committee for that. And it was the first time we had all these folks together from different academic institutions and health departments. Kathleen was there too. She was our keynote actually, I think. And it was a great opportunity just to see what other states are doing around the Western region. We've had to postpone it for this year, but we're going to be hosting it, hopefully, 2021 here in Pima County. So that'll be a collaboration with Pima County Health Department and the College of Public Health. So next slide. And here's just a little picture of our planning committee. So Julia and I were on the planning committee. Kathleen, I don't know where you are, but Julia and I are on the right, along with 3 other folks that we were lucky enough to plan the Academic Health Department Summit with. Next. So another thing, we talk about growth, and I just keep on having to say, you know, this graphic design internship, when I started this position, I had no idea that the graphic design students will be such a hit. And just to be clear, the graphic design students, they're not all trained graphic designers. They also are, they're communication students. They have, some of them are public health students, but they just have that skill set. And this has been a really great link to bring faculty and health department staff together on projects. And it's something tangible. And I think having something tangible that talks about what we're doing, something to provide the community with, and a way to just get away from kind of the abstract. And this example of a infographic, and these are all available online. This is a graphic that we developed for a mini public health school on germ transmission and hygiene interventions. And as you can see, I know it's kind of hard to see, but as you can see, it's kind of small, but it's very tangible and things that people can look at. And in the health department's roles, having the information to go out and let community members know as they go out to different places. And this really helped with getting faculty on board to support with joint projects with the health department, making it a win-win. And again, it's establishing that relationship, and then things just kind of take off on their own, which is fantastic. Next slide.
So another thing that came up that was a great opportunity for the collaboration is the College of Health Sciences Library reached out to the College of Public Health and to the health department and said that they were looking to have some support and collaboration to bring the yellow fever exhibit to Pima County. So we put together a quick turnaround, a quick response to that, to a proposal to do this, and we were accepted, which was exciting. And we were all set to do this the fall, right now, December through January, and to have that here. And the intent was to work with the libraries in the community and help educate the community about the politics of yellow fever, and as well as community education. And we had to put it on hold, which is okay because it's not gone forever. It just means that we're holding it, and then we'll get back into a schedule and a rotation for that display to come to Tucson and Pima County. Next slide.
Another outcome was the Stock Inhaler program, and this is in collaboration with Dr. Lynn Gerald, who's a professor with the College of Public Health and Pima County Health Department. So without going into too much of the weeds here, there was a Stock Inhaler for Schools law passed on the state level, which allowed schools to purchase, store, and administer the albuterol. And this was something that our Dr. Gerald and her team were doing. And really the goal is to transition that work to the county. And it was so fantastic because our partners at Pima County were on board, ready to do it. And the program was built by the U of A, but then was fully transitioned to Pima County Health Department. And they worked in collaboration to kind of get that program transitioned. And then by the spring of 2020, it's now in the hands of Pima County Health Department to implement and sustain.
And we were very excited about that opportunity, and we thought it was such a wonderful example of having a viable, sustainable relationship with our colleagues at the college. So moving now from some of the outcomes that we realized and some of the nuts and bolts of what we put together, all of this work was now put to a test. COVID-19 was now front and center in our community and communities across the country. Public health was facing a huge undertaking in circumstances that were constantly evolving, and we needed our partners at the College of Public Health. Next slide. This was uncharted risks and opportunity that our communities were facing, and we needed strong relationships to help us in looking at how to respond to the community and its needs. Our incident command system was stood up, and university faculty and staff were invited to be members of the command team. They were a part of and worked closely with public health professionals that are practicing public health in making decisions in the community and how we were going to respond and what were those efforts going to look like. Having them at the table and being a part of the incident command amplified and strengthened our newly formed relationship as well, because we were able to just bring our best of our best into this conversation and help make things happen. The scope of the response required a much greater community engagement. And with our partnership with the College of Public Health, we were able to strategically expand our reach into the community and be able to pull in those new partners to look at how we're going to help this community manage and navigate and reduce the risks of COVID. And you can see here, we had the epidemiologist was a part of it. Our history of working together and collaborating with MESCOF, we also brought them to the table to help us with the elementary and the high schools. Our K through 12 schools were struggling with how to go back to school, when to go back to school, what did that look like? Having our partners with the university at the table really helped to delineate what that looked like. This built trust. We had multiple points of contact and relationship, but always able to come back when somebody didn't know, they were able to come back to either Emily or I in this space of COVID so that we could help promote that. And as I mentioned earlier, bringing those students in and helping to introduce any opportunity for the students to participate in this work was critical to their experience of an emergency response within the public health field. Next slide.
So as Julia said, we had back in February 2020, there was a college-wide public health panel that was held, as we mentioned, the college public health seminars, and there's the health department represented on the panel to speak about COVID. So again, we started that conversation early. And some of the examples we have, as Julia mentioned, with the emergency response, we've been working with we have faculty currently working on the long-term care, looking at how to deal with COVID infections, controlling and tracking those numbers. We also have a class where we have students and a faculty member who are assisting with the contact tracing for positive COVID-19 cases. That's been wonderful to have those students. They usually do, they respond to outbreaks normally. So they've had to just shift gears really quickly. And now they're working on the COVID contact tracing. And then we have a lot of staff and faculty here at University of Arizona who've actually contacted me about just volunteering, and Pima County Health Department has set up a volunteer database. So we've had people, and I should mention students too in there, who've expressed interest in just volunteering, not as even part of the university, just on their own because they are committed. And I think they see what Pima County Health Department does and what a great organization and health department they are. And then, as Julian mentioned, there's a local incident command center, which is with the faculty and practitioners with both Pima County Health Department and MESCOF, working on the COVID response. Next slide. So this is an example of a collaboration opportunity. So this is, as Julia mentioned, working with the K through 12 school response. So I had my student interns develop some graphics working with some of our faculty based on the needs of the schools in Pima County. And this is an example of what they did. And this was actually presented. It was so cool. I made me so happy. So Pima County Health Department actually presented this on the graphics on a call with all the schools. I think there was something like, I don't know, like 150 people on there, which was just so exciting. So they had us on talking about our graphics library, but there's one example. Next slide, please.
So just to briefly kind of cover over, some of the lessons learned have emerged through our conversation, but we'd like to just highlight a few things that we learned in our partnership, and then just to take you to some of the next steps that both of our organizations are looking at in moving forward with our academic health department partnership. Next slide. So sustaining and cultivating the partnership, so important to remember our accomplishments and celebrate them with your partner. Make sure that they know how important they were to the work that was accomplished. It helps to ignite the creative and dynamic thinking. There was one of the things that you heard a little bit about was how important it is that when we explore those research projects, we want to make sure that we have a plan and that we're looking at a mutually beneficial opportunity that we can engage in 110% each to really make that a really successful endeavor. Creative ways to fund positions. There's been, maybe you can split a position that you can share. Our partners in Maricopa have half of an FTE, not a person, half of an FTE is for risk management. The other half helps to navigate and manage their academic health department activities. So they were able to find a way to help continue to advance that. And those are the things that we're looking at as well. And then of course, communicate, check in, always acknowledge the fact that you care. We found that to be real important. Next slide. Emily has talked about this, and as well as I have, overcoming those bureaucratic processes. If we let those be our barrier, it's very difficult to make a step because we're so intimidated or uncomfortable with trying to understand what our colleagues' processes are. But if we take a moment, we talk about it, there's oftentimes ways that we can navigate within both processes to make things happen. Making the partnership a priority helps to elevate it and give it the respect and the time and the resources it needs to be sustainable. The other thing is to talk about the lack of support or engagement. So I talked a little bit earlier about how we had stumbling start and stops. It's okay to acknowledge the fact that you might hear this was been tried and it didn't work before, or, you know, this is, why are we doing this? Acknowledge those. Maybe there was some past hurts that we have to bring to the table and say, you're right, that wasn't handled well. Own that so you can get past that. And bringing that out and talking about it, I think helps the relationship give it the genuineness that it needs to sustain those bumps in the roads that might come. And that comes back to that follow-up piece. So we acknowledge it, we follow up, and we work to be better and stronger going forward. And then just entering into those projects with a plan. I mentioned that before, looks like a repeat. Next slide, please.
What's on the horizon? So looking at what we've accomplished, we want to do more. So we want to work with other health departments here with MESCOF. I think the Pima County Health Department wants to work with other universities and colleges. So we're just starting, and we're so grateful though to have this great starting point with Pima County Health Department to continue and then spread this model to other health departments. And we're going to continue to connect with public health faculty and health departments. You know, COVID, there's going to be a lot of reflection when this is over on how this went, what we could have done better, what came out of it. We want to conduct those joint presentations, and we want to build on those new partnerships resulting from COVID-19. Next slide. And I don't want to go into a ton of this because I know we're running out of time, but I just want to mention the vaccine, that's going to be a huge partnership working together to roll out the vaccine, already working on that. We're going to continue supporting our health department partners as they support the K through 12 schools. We're going to rely on the health department to help us with the university. And as we continue to adapt to new norms, continue this collaboration and coordination with our community, looking at community-wide data, how we can look at that data to better inform public health practice. And we also, there's also been talk of mental health and suicide prevention strategies, how we can work on those issues, especially right now we're seeing the mental health due to COVID really taking a toll on a lot of people. Next slide.
From the health department standpoint, again, I mentioned resuming their internship program with the COVID protective measures in place and looking at how we can continue that work going forward, extending our partnerships to additional higher education institutions, and from the college standpoint into more of the local health departments that really expand and strengthen what an academic health department partnership looks like in Arizona. Resuming the student participation in our new employee orientation, we're looking at how to make that happen going forward. And then getting those many public health schools back up on track. If they're virtual, then let's see how we can do those virtually and get them moving along again. Identify those community-based projects and interventions where we can seek some funding and share some of the research, share some of the work for the research projects in looking at that going forward. And as a health department, we also are expanding our data collection and assessment aspect that includes the analysis of understanding our community in a broader capacity. And MESCOF partners are very much going to be a part of those conversations. Next slide. This is us. So here's a beautiful picture of Arizona, where Emily and I live and get to spend every day here. It's a wonderful community. This is our contact information, and we are so grateful that you have been with us today and that gave us this opportunity to talk about our partnership. Kathleen, Bill?
Well, we hope all of you on the webinar have found this afternoon's session informative. And really, I'd like to thank our presenters for sharing their time, expertise, and experiences with us. We do have a little bit of time for questions, and I know we've had some coming into the chat box. So I was going to ask Kathleen, who's been following them closely, if you would, to let us know what the questions are, Kathleen, and see what we can do to help people get answers.
Absolutely. So I know we've addressed some of them as we went along, and thanks, Emily, for helping with that. We do have a few in the chat box right now, and please do feel free to keep sending in your questions if we don't have time for them all today. We're happy to touch base with you after the webinar and to share those questions with the presenters. So first, we have a question about administrative roles. So what paid and unpaid administrative roles are needed from both the university and county sides to keep the partnership up and running?
Emily?
So I'll say from my perspective, I think, you know, part of our faculty, part of their work, we're also dedicated. So, you know, they do research, they teach, and then there's also the engagement piece. So part of their position is working with our partners. In terms of, for us, I am about 30 hours a week. So I am a paid position with the College of Public Health, and I was hired solely to coordinate academic health department efforts.
And with the health department, so I have just been able to hire a full-time person to help manage the internship program part of it, while I'm able to still work with Emily. And so that would be 2 paid positions. One is a manager's position, one is a support coordinator position, which will be invaluable to this work. Unpaid wise, I think it's important to bring up and mention the fact that our student internship is an unpaid internship program. We just don't have the funding to be able to offer the stipends or payment to those students. And so making sure they have a meaningful internship process when they come in is important. And they often support some of the academic health department work. So I would consider them an unpaid resource that their insight, their perspective, and their energy has been invaluable to some of the work we've done. It's not just about Emily and I working together, but bringing these students in have really, I believe, been an important unpaid component of it.
Fantastic. Thank you both. We have perhaps a quick question about Medical Reserve Corps. Does Pima County have a Medical Reserve Corps unit? Do you use that?
Yes, we do. Yes, we do. And yes, they're very much at the table. They have been here and they're amazing. And we're very fortunate to have a very strong contingency of them here and have been very much a part of our COVID response. Yes.
Excellent. Thank you. And one final question here, Emily, this question is for you. So you mentioned at the beginning of the presentation that your school has 2 campuses, one in Phoenix and one in Tucson. As your campuses are located in separate counties, could you talk about how students at both campuses are available to participate in the opportunities offered through your partnership with Pima County? Similarly, if students at your Phoenix campus can participate, how do you operate this partnership across campuses?
Great question. So one of the things that's really cool is that our the Associate Dean of Community Engagement, she's actually the dean at the Phoenix campus as well. So she has 2 roles. So it's fantastic. So she makes sure, you know, our Phoenix, she's really our voice for our Phoenix campus, making sure that our students are included in the faculty. The other thing is our faculty with the Maricopa, with the Phoenix campus, they're involved in our many public health schools, you know, through Zoom. I just had a meeting today with a Phoenix faculty member with our Cochise County academic health department. So So we do, we use the virtual world. We open the internships up to Phoenix students and students in Pima County. And I also will mention we have a huge online program. So we also involve students that way. So really I don't see a huge barrier in terms of having two different campuses. I see it as a huge opportunity. Great question.
Thank you. So I know we're right at time. I'll squeeze in this one. It looks like there's a quick follow-up question about MRC, the Medical Reserve Corps. And is there a connection between MRC and the university where there's specific recruitment of students by MRC?
That's you, Emily?
That is me. You know what? That's a really good question. And I will tell you, Eric, I don't know off the top of my head. So send me an email and I will get you the answer.
Excellent. Thank you, Emily. And thank you both. And please do feel free, like I said, to keep putting your questions in the chat box, and we'll follow up with the presenters and follow up with you afterwards. And I'm going to give the floor back to Bill.
Thank you so much, Kathleen. Well, just a final slide here to give you an overview of the resources available through the Academic Health Department Learning Community to anyone interested in exploring the nature of academic practice partnerships, how to develop new relationships, or how to maintain and improve existing relationships. I know Emily referred to using some of these tools herself during her presentation. So in addition to our regular webinars, you may wish to interact with our Ask the AHD Expert column on the Public Health Foundation Pulse blog. You feel free to examine our library of Academic Health Department resources and tools on the Public Health Foundation website. And if you don't already receive it, sign up with Kathleen for our newsletter called the Council on Linkages Update, which includes information about Academic Health Department partnerships. So with that, we'll thank you all for participating with us today. A special thanks again to our two presenters for a very clear and interesting afternoon. And with that, we'll wish you all good day. Until next time. Bye-bye now.